Checking the patient's chart. Okay. Gel in, place my gloves. Mr. Teddy, hey, how's it going? My name is Alfonso. I'll be your respiratory therapist today. Can you verify your full name and date of birth for me? Awesome. Can I take a look at your wristband? Okay, checks out. So I was taking a look at your chart, and it looks like the physician ordered an NTS procedure to be done. Have you ever had an NTS before? No? So an NTS is a nasal tracheal suctioning procedure, and what it does, it removes any secretions that you might have built up in your lungs or airway. What I'll be using for this procedure would be a basin, a lubricant, sterile water, an NTS kit, and a suctioning tube with a yonker attached. So this procedure shouldn't take too long. It should be pretty quick, about like 10 minutes. So also, when I was looking at your chart, it says that your lab works came in, and you're currently not on any blood thinners or have any platelet issues which can affect this procedure, because there's always a possibility of making the airways or your lungs that could cause bleeding and can affect this procedure. But since that's not the case, we're gonna go ahead and continue with this procedure. So, but first, before we continue, I'm gonna go ahead and take your vitals. So I'm gonna put you in the high phallic position. Get the post ox, sterilize, place it, check your heart rate and respiratory rate. Okay, and that's done. I'm gonna go ahead and listen to some breath sounds. Keep breathing for me. 1, 2, good. 3, 4, 5, 6. Okay, sounds good. Can you lift up a little bit? 1, 2, 3, 4, 5, 6. Okay, so there is some coarse crackles and bronchi. This will be indicative to the secretion you might have. So the secretion ability you might have. So I'm gonna go ahead and continue with this treatment. So what I'm gonna do first is I'm gonna pre-oxygenate you and increase that 502. Grab my suctioning tube and yonker. Place it on the suctioning port. Set the pressure to 80 to 120 torr. I'm gonna go ahead and put it here at the moment and take out the yonker, which we won't be needing it at the moment, and put it close to the patient. Now I'm gonna go ahead and prep my kit. So what I'm gonna do is put the sterile water on one and put the lubricant in another. I'm gonna go ahead and open up my NTS kit. So the NTS kit, when opening up, it comes with sterile gloves and a suction catheter. And what you want to do is maintain and practice sterility while doing so. So what I'm gonna do is open it, grab the gloves while practice sterility, put it on your dominant hand, which mine is to the right. Okay, grab the left one, put it on the left. Okay, all set. What I'm gonna do is grab with the sterile hand, grab the tip of my catheter, and with my left end of it. So I'm gonna go ahead and plug it into the suctioning port, suctioning port. Okay, and I'm gonna go ahead and test it first. So what I'm gonna do is I'm gonna dip it into the sterile water and press the port. Oh, okay, it does seem like it's working. Okay, it's all set, good pressure. I'm gonna go ahead and dip it into the lube and to begin treatment. So I'm gonna go ahead and begin treatment. Do you have any questions for me or any concerns? Are you ready? So if you do feel some discomfort, please let me know so I can stop treatment, but it should be quick. Okay, so what I'm gonna do is lift the mask in my left hand, okay, and I'm gonna go ahead and begin. Are you ready? Okay, so sounds good. So I'm gonna go ahead and insert the tip of the catheter through the nares. Okay, and pass. You might feel some resistance. How does that feel? Is that okay? Okay, I'm gonna hit the carina, pull back 1 centimeter, press the port and begin suctioning. While doing so, no more than 15 seconds. Okay, it's out. How did that feel? Is that okay? So it looks like we did take a lot some secretions out, build up. So I'm gonna go ahead and place my patient back on oxygen immediately. Remove the suction catheter, we'll practice sterility, put it on, Okay, now I'm gonna go ahead and connect my Yonker to the suctioning tube. Remove the oxygen and suction any secretion that might be in the mouth. Okay, how does that feel? Does that feel okay? Feel all right? Do you need is there anything I can do, or does that feel good? Okay, so I'm gonna go ahead and remove this, place this here. So what I'm gonna do is after just check your if that's okay, if you're feeling all right, I'll check your vitals again and check if the treatment was effective. So I'm gonna go ahead and place the pulse ox again, clean it, place the pulse ox, and listen to your breath sounds. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, so your breath sounds do sound a lot better. So how do you feel? Do you feel a lot better? Okay, good. So yeah, I'm glad you do feel better. It does sound like the treatment was effective. So now what I like to do is the treatment's all done. Do you have any questions for me, or did you need anything I can get you? Maybe some pillows, some blanket? No, you're all set. All right. So if you do have any questions or need me, this treatment that we just did is it's on as needed treatment. So if you do feel like you need another run through, then please let the doctor and nurse or myself know, and we'll go ahead and place that order for you. So if there's nothing else I can help you, well, just appreciate you. Thank you for your patience, and feel free to let me know if there's anything I can do for you. So go ahead and clean up my station. Clean up all my kit. Dispose of anything that may be contaminated. Take my gloves off. Gel out. Note on the patient's chart. And 3 indications of NTS would be visible secretions on the airway, on the airways. Upon auscultation, the sound of coarse crackles, diminished breath sounds, and rhonchi. And the increased tactile thermitis, or the feeling of secretions in your chest. Some contraindications would be nasal bleeding, tracheal surgery, or irritable airways. Some hazards would be nasal bleeding as well, some mechanical trauma, or a bradycardia. Thank you.